Hello, everybody. Welcome to Diabetes Boot Camp. My name is John Vredenberg. I am a diabetes care and education specialist working for UF Health in Jacksonville, but I also welcome those of you in Gainesville and other outlying areas throughout the University of Florida community. And I hope you find this course to be something that'll help you move forward and set healthful goals for yourself and caring for your diabetes. What I really want to do is make sure that we're getting everyone off to the right, on the right foot here and understand just exactly what to expect over the next several sessions. So as you see on your screen is our complete agenda over the next 7 weeks. Each of these classes is based around one of the self-care behaviors for diabetes self-management. And it all begins with healthy coping, understanding how to cope with a condition like diabetes. And we'll spend some time talking about healthy eating, physical activity, taking medication, when to monitor your blood sugar, and then also spend some time talking about reducing the risks of diabetes and then making sure you understand problem solving. So again, each of these is taking a look at one of the 7 self-care behaviors, but also want to make sure you have any other concerns addressed throughout. So at the end of this program, after June 1st, our last session, you're going to be giving an invitation to sit down one-on-one with a diabetes educator, either myself or one of the dietitians on our team, to talk about specific goals that you might have, just to make sure that we're doing everything we can to get you connected with the right type of care. Each of these classes are recorded. I will send out information about the complete recording as well as any slides that are covered through each of the classes after every single class. And then for those of you that are under Gator Care and are looking for points towards your wellness credit, you will also receive 100 points towards your wellness credit by completing each of these sessions. So again, I encourage you to keep your cameras on, and just so I can kind of put faces to names, I've got mine on, hey, this is the only face I have. So hopefully it works for you. But we want to make sure that, any questions that have hit your mind, go ahead and type them in the chat. It's easier to navigate questions that way versus unmuting yourself, but there'll be plenty of time at the end for kind of an open forum of discussions using the microphone. So as I said, when we look at diabetes in and of itself, at the center of that wheel, the center on your screen right there, you see healthy coping. That is going to be the essential first step to proper diabetes self-care. We all know about medications and diet and exercise and monitoring blood sugar, but if we're not ready to handle and cope with our conditions, handling each of those other areas of diabetes self-management can become even more difficult. So just as a review, I think many of us are aware of what diabetes actually is, and most of the people on this call right now are dealing with a form of diabetes called type 2 diabetes. But there's essentially 2 main types of diabetes: type 2 diabetes, which is primarily an insulin sensitivity issue, versus type 1 diabetes, which is also known as juvenile onset diabetes. That involves the complete lack of insulin production. But basically, what we know about diabetes is a chronic, meaning long-lasting condition that really impacts how your body can take all the food that you eat and convert it into energy. With diabetes, whether it's type 2 diabetes, where the body isn't producing enough insulin or it's not working as well, or type 1 diabetes, where the body isn't producing any insulin at all, blood glucose levels begin to rise, and over time, that's going to really wreak havoc on our blood vessels. And that's what really increases the risk of some of those long-term complications that some of you are aware of, like blindness and kidney failure and nerve damage. All of these are the result of long-term impacts of elevated blood sugar. And for those of you that are monitoring your blood sugar and may have noticed a blood sugar reading of maybe 200 or 300 and really haven't felt any acute pain because of it, but what it's doing behind the scenes is really causing a lot of damage to the blood vessels, which is why with diabetes self-management, we want to make sure we're trying to keep those blood sugar levels within range. And it's important to make sure you're using a term like in range. I try to caution people against using terms like, oh, your blood sugar is good or your blood sugar is bad. It's not anything that we're judging people on. It's all about understanding all the factors that impact your blood sugar. So blood sugars aren't good or bad. They're either in range or they're outside range. And through this program, you'll be able to help troubleshoot when those blood sugar levels are out of range and what you can do about them. If we look at it from a pictorial standpoint and try to understand what's happening with type 2 diabetes, we know anything that we eat, we have to turn it into energy to put it to work. So whether you're having a sandwich right now or eating a banana or whatever it is, your stomach is going to convert that food into glucose, going to convert into glucose in the stomach or in the proximal part of the small intestine. That glucose is going to enter the bloodstream because it needs to get into those cells. And the pancreas is producing insulin to help shuttle that glucose into those cells. But because of some mechanism we're still beginning to understand, there's a lot of insulin resistance that's going on right now. So that energy from the food that you just ate isn't able to get used effectively. So that blood sugar level remains elevated. And that's why some of the symptoms of an elevated blood sugar over a long period of time could be a lot of just energy loss, where you're not really getting the energy from the food that you're eating. Then you'll also see some secondary symptoms as a result of trying to get rid of that extra sugar, where it's being dumped into the urine, which causes frequent urination and also can lead to dehydration, which is why you'll see excessive thirst as another big symptom of hyperglycemia or high blood sugar. So again, a quick review of diabetes in and of itself as far as a health condition goes, but many of you filled out a survey, or at least got to the part of the survey where it asked you a question: what is the biggest struggle in managing your own health condition right now? And what I have on the screen, and may be able to see this depending on the size of the font on your monitor there, but most people are in agreement that the biggest challenges that they're having right now is managing their weight, getting enough physical activity, choosing nutritious foods, getting enough sleep, and then also managing stress. So we've done this course a couple of different times, and I recognize some names from previous registrations. So this is essentially the same material. You're more than welcome to attend it as many times as you want. But one thing that remains consistent are those struggles in our health. And that's all about getting enough exercise, choosing nutritious foods, and managing stress. Each time we offer this course, those appear to be among the top 3 issues that we are all dealing with. And when you have a chronic condition like diabetes, it can cause a lot of stress, a lot of anxiety. There's a lot of decisions that have to be made. You have to understand all the different variables that impact your blood sugar. And sometimes when you have all of those variables to manage, you just want to throw up your hands and kind of hope it all goes away. So what we're going to do today is talk about healthy coping with diabetes, but more importantly, give you some resources that can enable you to help get on that path towards healthy coping, and when to seek out the advice of a professional if you feel too much stress or too much anxiety with regards to managing your own condition. So one of the things I want to do right now is introduce you to a patient named Yvonne. Now, Yvonne is essentially a fictional character, but this is from a CDC learning module that talks about healthy management of type 2 diabetes. So Yvonne is sharing her story about her initial diagnosis with type 2 diabetes. But I want you to listen for a couple of things with this story. Her story is about 4 or 5 minutes. Hopefully the audio will work okay, but listen to how Yvonne reacted initially. Listen for how the denial affected her health, and then also ask yourself, what are some of the other emotions you may be experiencing with your own diabetes? Are you guys able to hear that? Shake your head, yay or nay. No? How about now?
No.
No? Okay, hold on one second. Aha, check the share sound box. There we go.
And I have diabetes. I've
Is that
had
better?
diabetes for over 25 years. And the way I discovered that I had diabetes, I was applying for some life insurance. And one of the things they did was a glucose tolerance test. And at the time, I was told that I was borderline diabetic. And the term borderline to me meant that I still had time to play. I really wasn't diabetic, but eventually I would become a diabetic. But just at the mention of the term diabetes, I went straight into denial and I ignored my disease for a very long time. I weighed over 200 pounds. I smoked 2 to 3 packs of cigarettes a day. I didn't do any kind of exercise and I ate whatever I wanted and how much I wanted. And I was wearing a size 20 dress. And I was feeling bad and had all the symptoms of diabetes, but in my mind, I rationalized that, well, it was something else. My vision blurred because I need glasses. I'm thirsty all the time because I'm tired. I go to the bathroom because I drink a lot of water. And just totally ignored the disease. And even after I got my official diagnosis that I was diabetic and need to be on medication, I was a poor complier. I didn't take any medication. I didn't check my blood sugars as I should. I didn't exercise or anything because in my mind I didn't have diabetes because when you're in denial, that was a comfort zone to me. I didn't have to address the issues of diabetes. But what I found out that it was also a deadly zone because as a result of me ignoring my disease, I allowed complications to start. Both of my parents later became diagnosed with adult onset type diabetes, my father first and then my mother, and then my oldest sister. And theirs was lack of knowledge. My oldest sister, like me, in denial and just didn't want to hear about diabetes, didn't want to learn about diabetes, and didn't want to make the lifestyle changes. She too was overweight and she was a smoker and didn't exercise either. So people would tell me all the time, well, you're a nurse, you're supposed to know better. Yeah, but knowing better and doing better are two different things because I still face the human challenges. So one day, her little voice said to me, Yvonne, do you realize what you're doing to yourself? And I decided then that my lifestyle was killing me. Not exercising, not taking medication, not checking my blood sugars, not trying to follow any type of meal plan. And I had to acknowledge that the numbness in my feet was a result of nerve damage from my uncontrolled diabetes, the coronary artery disease, the patches on my arteries. So I made the lifestyle changes. I decided, yes, I want to live. I like life. So I quit smoking cold turkey. Didn't have the withdrawals or anything because I was determined that I liked living more than I liked cigarettes. And I came to the conclusion that food was not worth dying for. So I looked at how I was eating and made healthier choices. And I started walking. And in the beginning, initially when I started, I lost a total of 50 pounds. I came from a size 20 to a cute little size 12. So in life, you have to find something good in everything bad. So yes, it was bad that I developed diabetes, but it made me start taking care of myself, and it got me a cute little size 12 at the deal too.
So what do you think about Yvonne? Can you sympathize with some of what she was going through, perhaps? Very common to deny things that we're not ready to believe in. And, I think we can all relate to some aspects of knowing better and doing better are two different things. A lot of times working in healthcare, we're acutely aware of what needs to be done with certain health conditions, but sometimes there's other things just going on. And that's why the healthy coping is such an important part of that, because one of the questions I would have asked Yvonne is, what actually happened to lead her to that, step where she decided she was going to change everything. She said one day she heard a little voice, and it talked about all the things that um are going to be so much better. So I was wondering what that trigger was for her that made her kind of see the light, if you will. But I think it resonates to just how important healthy coping is, because until she got to that point where she was ready to cope with that condition, it was pretty much handling her. And what we tell people with diabetes, that you can manage diabetes or it can manage you. So it's one or the other. And you're usually going to see much better results if you are the one doing the managing. So again, I think there's a lot that we can appreciate with what Yvonne went through. And she also brought up a term that we don't really use anymore, but maybe we should have been using it. And that's something called borderline diabetes. So that was a term that was always thrown around there back in the day, borderline diabetes. But really what we come to find out that it's really pre-diabetes. So we used to, the classic joke was, you're not borderline diabetes, like being borderline pregnant. You either are or you aren't. Okay. But borderline diabetes is actually, in fact, pre-diabetes. And those of you that may know somebody at risk for diabetes, it may in fact be someone with pre-diabetes. So it's a different condition altogether. But open it up to discussion here if you want to type it in the chat, or what are some of the emotions you experienced when you were first diagnosed with diabetes? Don't all share at one time.
Mine was that I couldn't believe that, I would get something like this. I had a lot of stress going on, and I had a lot of the signs and symptoms. Always thirsty, frequent urinating, that type of thing. And how mine was found is my eyes were blurry. I was looking at the computer at work one day, and I said, wow, I need glasses. So I went over to Shan's eye doctors, and one of the residents, she said, just by chance, she said, she told the nurse, she said, go get the glucose monitor. And sure enough, my sugar was like right at 400. And so they actually used me as a study case with her being able to find it that way.
Oh, okay. Yeah. Well, thank you for sharing. Yeah, that's interesting. Yeah, when we look at some of the symptoms of elevated blood sugar, that the elevated blood sugar also can affect our vision, and that's why a lot of times blurred vision is one of those underlying factors that we tend to look at. I tell you, for me personally, many of you may not know this, but I have diabetes. I'm a diabetes educator that needs a diabetes educator. I was diagnosed, however, with type 1 diabetes as a teenager. And my emotion was, what the heck? I was just overwhelmed, like one of those things where you're like, why me? Why is this happening to me? And after enlisting the support of, my parents and the healthcare team and people at the Juvenile Diabetes Research Foundation are really, really open my eyes that it's something that happens to people, and learning to manage it is the best way to move forward. And it really actually set the stage for me to choose the career path that I did, becoming a dietitian and a diabetes educator. So yeah, for me, my emotion was, whoa, why me? Denise sharing the her first consultation with the endocrinologist was insulting and condescending. So yeah, if you don't have that good personal connection with your healthcare provider, that's a big thing too. And I think now we have a lot of tools at our disposal where we can become informed consumers and demand better care from our healthcare providers. And if you're with a healthcare provider and it doesn't really seem to be working well for you, we've got many more that we could use. So by all means, don't subject yourself to somebody who's going to be insulting and condescending. So very good. Well, thank you everybody for sharing those thoughts. I want to kind of move into some of the aspects of today's class when we talk about healthy coping. By definition, you can see it right there on your screen. It's just having a positive attitude towards your own condition and a positive relationship with other people. And it's the integral part of all of these self-care behaviors, because just like with Yvonne, until we realize we were ready to take action, there's nothing else that we could do. But once we're ready to cope and move forward, all the other aspects of diabetes self-management can fall into place. It'll still be a challenge, can still be overwhelming at times, but you'll begin to see the big picture, because what we're really trying to teach here is understanding that stress happens to everybody, and diabetes is a double-pronged type of stressor, because it can stress you physically in terms of your impact on your blood glucose levels, but it's also an emotional stressor. And just to review a little bit about stress 101, we all deal with stress, and most of us will actually perceive stress as just always negative. But in fact, there's kind of a positive stress too. You know, when we look at stress by definition, as you can see on the screen there, just a response to any demand triggered by change. And there can be positive stressors in our life, like, you know, maybe getting married or having a child, and that presence of positive stress, even in the workplace, can move us to be more productive and keep us motivated. What we're trying to guard against is getting past that tipping point where we're looking at something that's more distressful than it is eustressful. And that's what we look at in terms of diabetes self-management. We want to keep people from going over that hump, because that long-term stress, that chronic stress, can really impact our blood sugar levels significantly, because there are other hormones at play when we're dealing with chronic stress, like cortisol, which, in addition to elevating our blood sugar levels, also affect our appetite and increase our deposits of body fat and lower our metabolic rate. And when we look at one of the things that many of us are struggling with, weight being one of them, you can see how not managing that stress or understanding where to go for stress management can really impact our health and well-being over the long term. So I wanted to share with you some of the mental health resources that are available for everyone in the UF and UF health community, because I think there's now finally getting some clarity and some attention and removing the stigmas associated with seeking mental health. This is something that if you have diabetes, it's important to be screened for this on a regular basis. We are at higher risk for mental health issues because of all the day-to-day stressors that we're dealing with on top of our life. You know, diabetes is now like a second full-time job that you can never really quit. So on top of everything else that you're going on in your, or that you're dealing with right now in your life, diabetes is another thing that we have to try to manage. But again, by giving attention to medications, meal planning, and physical activity, the management piece can take care of itself. What I have on the screen now are just some tips to take with you the next time you go to see that physician. And if you're not getting the right response or the right feedback from your healthcare provider, let somebody know. I know in the UF health community, we all get surveys after we go see our physician. So this is a good time to share some of that feedback, whether it's favorable or unfavorable. So as an organization, we can take steps to make sure we're getting our providers meeting the needs of our patients. But talk about what's the most concerning for you right now. Is it the medication? Is it the cost of your copay? Is it how to set up a meal plan? Is it knowing when to take your medication and understanding some of the side effects. What are some of the other feelings that you're going through? Are you confused? Are you worried that a certain medication won't be covered anymore? Are you frustrated that you have to get all the different prior authorizations done? Whatever it is, don't be afraid to share those feelings with your healthcare team and healthcare provider, because there are other things that we can do to help address some of those conditions. And outside of this, let's say, well, you know what, John, I don't see my doctor for another 6 months, and I'm kind of going through some stuff right now. How do I know when it's time to maybe seek out some professional help, either through some of our mental health providers or through some of our other resources under the Gator Care umbrella? How do I know? Well, one of your homework assignments for today's class is going to be one tool that can at least let you know when you might need to seek some help. This is what's known as the Diabetes Distress Scale. So this is a sample question that you see on the screen there now. So you'll go online, take this test, and it's anonymous. You don't have to register. You don't have to set up an account. There's no username and passwords. Hallelujah. I spend half my day resetting passwords, but none of that is here. You click on this link and I'll share it with you in our follow-up email, 17 items, okay? And you report whether or not this is not a problem at all, a slight problem, a moderate problem, somewhat serious problem, so on and so forth. And after you complete this, it'll give you a score. And scores sometimes are relative, because I don't know what that score means. But the good thing that I think with this particular scale is that it'll show you what areas you might have the most distress, and that'll help you better kind of seek help and corrective action. So it'll let you know, well, your stressor is mostly emotional, about feeling overwhelmed or fearful about the condition, or is it related to the regimen? Maybe you don't understand the meal plan or your exercise guidelines. Is it interpersonal? Maybe the people in your inner circle aren't giving you the type of support that can be beneficial for you. Or is it about the physician? Worry that you're not getting the proper guidance and expertise from your healthcare provider. So understanding the source of your distress can enable you to better form an action plan to move forward. So again, this is something that I think is a very important tool for you. It's not diagnostic. It doesn't, whatever you put there isn't going to be something that's going to give you an immediate diagnosis of anything. But to me, it helps finally identify what areas might be causing you the most distress in your diabetes lives. Now, the other question to ask is, well, I fill out the scale and some of the scores were a little bit above the range that was shown on the guideline there. What to do? Well, you've got several options as a UF or a UF Health employee. First thing, if you feel that diabetes is really defeating you and really controlling you, you talk to your primary care provider. We also have an EAP provider here on the UF Health campus and UF campus that's available to all employees and your dependents. So not just yourself, but also dependents are able to use our EAP provider. We also have an online mental health resource team called Talkspace. So Talkspace is contracted through Gator Care, and they provide free mental health counseling to employees and their dependents under the Gator Care umbrella. So these are three relatively accessible resources. I don't know about your primary care physician, but at least EAP and Talkspace are some areas where you can look at for seeking some support and guidance if you feel that, these are some of the symptoms I'm going through. I'm just not interested in anything anymore. I'm sleeping most of the day. I can't concentrate. Those are some of the hallmark symptoms of seeking out some help. And those are the tools, the EAP, the Talkspace, as well as a secondary referral to maybe a psychologist that can help you move forward, so we can make sure we got you in the right frame of mind to help manage diabetes. Now, outside of that, just trying to maintain healthy coping strategies day to day, take a look at your inner circle. Are you getting emotionally supportive relationships? Because that seems to be one of the secret weapons, if you will, for healthful management of diabetes, having the right support system in place, not just on the healthcare side, but at home and at work or in your circle of friends. Are you getting the type of support that's helping you feel good? What else could we do in terms of popular coping strategies? Well, we're all familiar with getting involved in hobbies and being active and participating in other types of community activities. I've also found that volunteering your own time is another way to help positively manage our own stress, or at least put us in a position where we're not dealing with as much stress, because the act of giving back also kind of fills us back up and helps us feel good as well. Another time, it might be to take a look at those sources of stress and try to distance yourself. And again, it goes back to trying to maintain emotionally supportive relationships. So if there's those people in your life that are those negative Nellies that always seem to bring you down, well, maybe keep your distance from some of those sources of stress is the best course of action when we look at some of the popular coping strategies. And when we look at those support systems, let me know if you've heard this before. Anytime you've been at a party or an event, you don't need another piece of that. It'll raise your blood sugar, right? How many people get unsolicited dietary advice about how to manage your condition? I'm a dietitian and a diabetes educator. I get it, so it can be frustrating. But the thing to keep in mind here is that your family and friends, they can't read your mind. I've found that although we're reluctant to say it, let your support systems know what you need and don't need. Say, hey, look, I appreciate your feedback and concern, but I feel comfortable with making some of the decisions that I need to make for my own health and well-being. And always try to look at how you're wording that statement, because if you're telling somebody who cares for you, say, you know what, you are really annoying me with that, that can be perceived pretty negatively too. So instead, use it from an I standpoint. Say, you know what, I feel bothered when you provide unsolicited advice on what I should do. So using the I feel versus blaming, or the you statements, could be the best way to go there, and just communicate it, acknowledge and appreciate their concerns, but just communicate, hey, you know what I feel like I need right now is I need you to do this or that. And this is another way to really help manage those support systems, because a lot of times, remember, you're getting this advice from people who really do have genuine feelings of care for you, and they think they're giving you practical advice or helpful advice, when in fact it can just be counterproductive. Now, outside of that, there's a ton of other online organizations and community organizations designed for persons with diabetes. I'm going to share them with you in our follow-up email with these slides, and a whole host of different websites and blogs and links that you can find resources here. Probably one of the biggest and most well-known here is the American Diabetes Association. So if you go to diabetes.org, they've got plenty of tools available. If you want to get connected with the chapter here in the North Florida region, they've got all the different support group organizations listed as well. I'll share that with you. But again, you might find something helpful there as another avenue for helping build your diabetes support system. All right, so as we approach the end of today's session here, I'm going to give you your homework assignment. And one of the biggest parts of your homework assignment is developing a goal. Okay, so when we're sitting down and trying to figure out, okay, what do I want to get out of this program? I'm going to give you all types of information myself, as well as our pharmacist and our wellness coordinator. There'll be several speakers that are lending their expertise all throughout each of these 7 modules. But what I want you to do today, or at least get started on today in preparation for the rest of our time together, is setting a realistic goal for your own diabetes self-management. You don't have to turn this in, you don't have to submit this for a grade, but ask yourself, what exactly are you going to do? What is it that you want to accomplish with this program? Is it related to nutrition? Is it related to physical activity? Is it related to medication? Is it related to emotional support? When we look at setting SMART goals, many of you have seen this acronym before. If you've been to some of our other health and wellness programs, we want to make sure it's specific, measurable, attainable, relevant, and timely. So a goal like, well, you know what? Through this program, I want to learn how to eat better. So is that a SMART goal? Sounds good, sounds important, but it's not really a SMART goal. We want to try to make sure that when we talk about goals, it needs to be specific. So eating better, well, that could be maybe including more vegetables. Oh, I want to eat more vegetables, but see, that's still not specific enough. So maybe your goal would be to include one non-starchy vegetable with dinner 4 times a week. So you can see it's specific, it's measurable, it's relevant, and it's timely. So again, take some time to think about what your goal is, but I want you to set a realistic goal for your own diabetes self-management, whether it has to do with your medication use, your meal plan use, or your physical activity. And we'll get started with that for the rest of our program. The other thing I want you to do is find your why. Find your why for living well with diabetes. Yvonne found her why. In her story, she realized one day, you know what? I don't want to do what I'm doing anymore. I'm going to stop denying diabetes. I want to take action. I want to give up smoking. I want to lose some of the weight. I want to be more active. Something triggered her, and it was her why. So what I want you to do, and this isn't really a scientific type of experiment here, but when we look at trying to understand your why, your reason for living well with diabetes, one approach to doing so can be just a simple pros and cons list. Look at all the pros and cons of your goal, whatever goal it was that you had just set up there. What are the pros? What are the cons? And what I want you to do is put a line through any con that is really just an excuse. So if you're looking at a goal that's related to increasing your amount of physical activity to a certain threshold each week, and one of your cons is, well, I don't have the time to do that. Well, that might be an excuse. So cross that out. And then eliminate any of the cons that are really just a perceived limitation. Maybe you have a healthy eating goal and your con is, well, I don't really know how to cook that well. Well, we can learn how to cook. And then they also want you to eliminate any of those extrinsic reasons for living well with diabetes that are more short-term motivators that really aren't going to keep you motivated over the long term. So another classic example of this are people that want to lose weight just for a wedding. Well, once that wedding comes, then what happens? So eliminate all those extrinsic reasons that aren't going to keep you motivated over the long term. And what's left? Everything that's left, that's your why. Okay, that's your why. So whether it's more healthful, productive time with your family, or the absence of any long-term chronic complications, that's your why for living well with diabetes. And it's can be different for everybody, but that is what's going to help us put ourselves in a position for healthier coping and better success with diabetes self-management. So that is your homework. Those 3 things: your SMART goal, finding your why for living well with diabetes, and taking that diabetes distress scale. So we're all adults. I'm not collecting this homework, but in order to get the most out of this program, it's important to try to do each of these before next week's class on healthy eating. So we'll be talking about healthy eating, and if there's any aspect of diabetes that causes more questions about what to do, it's food. So I'm going to talk about all the different food groups out there, talk a little bit more about carbohydrates and its impact on blood sugar, and also give you some basic guidance on what's a reasonable threshold for carbohydrate, because there's a lot of new research coming out letting us know that there are actually healthful limits for carbohydrate consumption, and maybe getting on the lower side of that might be more helpful for long-term diabetes success. So again, we'll talk a lot about healthy eating. We'll look at food labels and answer any questions you might have about that too. Remember, at the end of this program, after each of these 7 weeks, you can use that time with the diabetes educator to also map out a more individualized meal plan for yourself, whether it involves carbohydrate counting or calorie counting or portion guides, whatever's going to work best for you. That's going to be the most sustainable and practical healthy eating solution. So if there are any questions, go ahead and unmute yourself or type it in the chat. And I look forward to seeing you next week. I'm going to hang out here in our virtual lounge here to answer any questions you might have. But if not, I will see you next week, and look for an email either later this afternoon or first thing tomorrow morning with all the follow-up materials, the slides from today, as well as that support system resource guide that I just mentioned.